Going to talk about what is the cause of runner's knee or patellofemoral pain syndrome, PFPS. Now, some of you had asked me to do a few topics on the knee joint, and that's what the couple of videos from today, from today onwards, is going to be. So, I'm going to cover different topics for the different problems that we have around the knee. So, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their aches and pains which stem from being a mom. Now, this could be, your back pain, neck pain, or any other joint pains that have started either during your pregnancy, childbirth, or toddler years, or after. So, as moms of younger kids, we are quite busy with work, juggling your work, your travel, meetings, home, kids, etc. It's a lot on our plates, and sometimes our aches and pains are sort of brushed under the carpet. What which should not happen. So I this is where I come in and help you with simple strategies and easy exercises that you can integrate into your daily routines. That doesn't take away like a substantial chunk of your daily time, and that's how I help you. All right, so let's go on to what is the cause of runner's knee or patellofemoral pain syndrome. It's quite a mouthful, this term. So basically, in simple English, what it means is if you have pain in the front of your knee or you feel pain right behind your kneecap, that is the PFPS or runner's knee syndrome. So what happens is in your knee joint, let me just break it down in case you're not very familiar with the anatomy of the knee joint. So what happens is you have your thigh bone and then you have your leg bone, and obviously in between is your knee joint, and on top of that knee joint is your kneecap or the patella. So there is a certain pattern or style in which your patella, your kneecap, moves over that thigh and leg bone. And sometimes, there can be different causes, but sometimes because of an injury or a trauma, like say you've been in an accident or you've fallen over or hit your knee somewhere, or excessive overuse, say sports, or just using your your knee in a wrong um, in with wrong biomechanics. So basically what it means is using it at wrong angles. Say there's a certain way in which you stand. For example, if you have flat feet, so your feet basically, instead of saying straight like this, you are rolling in. So if this is, say, my right foot, I'm rolling in. Now what will happen is obviously your body will get tilted to one side. So in order to compensate for that, your thigh muscles on the outer side will try and compensate by uh, pulling towards the outer side, so your body doesn't roll towards the inside. Now what happens in that is there's a lot of strain on your kneecap there, and it sort of misaligns from its normal position. So there can be multiple reasons for patellofemoral pain syndrome or runner's knee. Could be that you have tight hamstrings, tight calf muscles, or this is usually seen with people, even in kids, who do frequent jumping, running, squatting, or excessive stair climbing. It's not necessary that if you do this, you will get runner's knee, but these are some of the things that can predispose you to runner's knee. So if you have pain in the front of your patella, and say you are you're at work, you're wearing your high heels and you're walking to and fro, like around your office or to meetings and back, and you feel that pain in the front of your patella, you'd probably remember this video and think, oh, maybe I have PFPS. So you can go to your doctor and then you can discuss this with him. So if you have patellofemoral pain syndrome or runner's knee, I'm just looking at my notes here. Yeah, so you will also feel the weakness in your quadriceps. You may or may not feel it, but your inner quadriceps, so if this is, say, the front of your thigh, so the inner part of your quadriceps, the which is known as a VMO, that's the name of the muscle, that might be weak, and you need to obviously go to your physical therapist, or you need to do a bit of strengthening and muscle balance work around there. Anyway, I'm not going to cover the treatment part here, so I'm just talking about the causes, and I'm talking more about the runner's knee here. You might have pain when you're climbing steps, especially when you are climbing down the steps. This is a very characteristic thing that will happen when you have runner's knee. When you're climbing down the steps, you will have that pain in the front of your knee, or say you are a runner and you're running downhill, you will have pain in the front of your knee or right behind your kneecap, so inside your knee joint. So not on the sides, but in the front of the knee. Now, a very common question that is asked is, does the runner's knee go away on its own? And this is what I'm going to address in the next video, which is going to be after one day. And if you're watching me on YouTube in a future date, then if you look on my YouTube channel and just put in runner's knee, you will come across that video. um, Also, yeah, another thing is you might have some clicking, grinding, or rubbing sound, because when that kneecap is sitting, say this is your knee joint where you have um, your thigh and your leg bones are coming together, and then you have the kneecap in front. This kneecap is the inner side of the kneecap here. It tends to get a little rough and it starts to rub on that thigh bone. So you might find you have some crackling, grinding, or rubbing sound whenever you are doing any action, especially downhill or climbing downstairs. I mean, climbing down the stairs. So yeah, so I hope that gives you a general idea of what is runner's knee. And if you're suffering from it, then you have a better idea what is the problem, and then you can tackle it accordingly. And if you have any questions for me, please feel free to pop them into the comments of this video. I'll be happy to help you there. And if you are still confused about what's happening with your knee and what is the reason for your knee pain, I will leave a link in the description of this video for a free guide that I've made on what is the source of your knee pain. It covers a few common conditions, and it gives you it gives you certain points that you will see when you have runner's knee, certain points when you have, say, ITP syndrome, that is outer thigh pain, etc., etc. So I have a few of the common topics covered there. You can have a look once you click on the link in the comments. Alrighty, I hope that was useful for you, and I'll see you guys next time.